mean, it very much depends on the individual for sure. A lot of times we're working with the patient and kind of meeting them where we're at, especially if we are talking about stress on top of all of this. A lot of times there is this, I guess, this sense of overwhelm for a lot of patients where we kind of need to break things down and do things a bit more systematically. So in the beginning, I would say a lot of what we work with is just focusing on whole foods and just anti-inflammatory foods, trying to just really make it as simple as possible, focusing really on the protein intake and not necessarily about really restricting the diet. And then as we start to unfold things like the stress and patients are feeling a little bit better, more energy, all of that sort of stuff, then we can get a bit more nitty gritty with the diet and start to get a bit more specific for that person's needs. Emotional health is huge for a lot of physical symptoms. We find a lot of the times there is this emotional component, especially with women and women's health. I would say like a very common example would be in menopause. A lot of women are starting to see, kids leave the house and things like that. And so there's this component of that underlying emotional stress that's also coming along with a lot of these physical changes. So it's super important to integrate both of those things as we're, talking about a whole, conceptual treatment plan for something like hormonal health. My favorite adaptogenic herb would definitely be ashwagandha. Ashwagandha is really fantastic for a lot of different cases. A lot of times it is really nice for cortisol balancing. So we're trying to kind of keep patients in a middle ground when it comes to cortisol. We don't want you to be too high and too stressed out or too low and not have enough of that energy. So ashwagandha is really nice just for balancing the stress response, supporting stress resilience, your ability to withstand stress. So it's a really, I would say, multifunctional herb and tends to be really helpful in a lot of cases.